Welcome everyone to another wonderful episode here at Jaws Podiatry. We're here in our office-based surgical suite. You know, we have a lot of patients, not only that come here, but all throughout the world that are always, complaining about pain on the ball of the foot. There's a condition that's actually called, and I'm going to try to keep this one short and sweet, metatarsalgia. There's a lot of reasons why individuals get this condition. Again, metatarsalgia. Anything that ends with the words AGIA means inflammation. In lay terms, this is kind of like a bursitis. There's also another saying that, the catalyst never lies. Come around here, please. So we see here that this individual has a very painful corn on the bottom of the right foot, underneath the second metatarsal head. Obviously, you guys can't see, but there's the metatarsals, right? The second and third metatarsals are longer than all the others. So when the patient is actually walking, the first two bones that hit the ground are the second and third metatarsals. Why? Because they're simply longer. Now, in order to, aside from, we're not going to talk about foot structure or biomechanics. What we're planning to do today is we're going to go ahead and using our minimally invasive techniques, one little suture on the top, and we'll probably have just two. We're going to go ahead and shorten these metatarsals just a little bit to get them in the right position. Okay, so just imagine if this metatarsal head and this metatarsal head are way longer. We want to actually bring them, right? So there's a nice rainbow, right? We look at the rainbow, just like when we look at the rainbow of the toes. And that's going to really, really eradicate the discomfort that the patient has been battling for how long now?
About a year and a half.
Acutely.
Acutely about 6 to 8 months.
And this is affecting the patient's daily life activities. So, when we talk about function, this is how we eliminate that pain on the ball of the foot. Yes, there are other alternatives, but when the pain from the structural deformity starts to affect daily life activities, minimally invasive, procedures, such as this one, performed under local anesthesia in our office-based surgical suite. And that's exactly what we're going to do. We're going to put a standby here, and then after the procedure, I'll show you guys what we did. So stand by, everybody. Great. Okay, just are we rolling?
We're rolling.
We're rolling. Okay, so very important. So what exactly, Dr. Wagner, what exactly are we doing, right? We spoke about what we're sort of doing. So make believe this is a side view of the metatarsal. So right now, the metatarsals are kind of like this, okay? The skin is down here. So what we want to basically do is make a tiny little cut in the bone. These bones, I've always said it, and Dr. Nunez and myself were always talking about it, but these bones have a mind of their own. The minute that we make that little cut in the bone, the metatarsal head, which is basically, let's say at a 10 or 15 degree angle, right? All of a sudden, once you make it, you automatically just like like an accordion, it'll just go boink, and it will find its own way. The body is absolutely incredible, right? The human body. And when we talk about anything structural in the foot, especially this procedure, the metatarsal head, right, knows where it wants to go. It just knows. So once, and it's like immediate. Now you see it, now you don't. And that's the purpose of the procedure. So we're going to go ahead and do that to metatarsals number 2 and metatarsal number 3. And in a couple of weeks, right, the patient is automatically going to feel so much better. Okay, so that's the purpose of the procedure. And the reason, again, why you're getting that metatarsalgia, that burning, that aching, that dull pain on the ball of the foot is because of this. A lot of women that wear high heels, throughout the years, they experience this condition because all the fat, right, being in this position for so many years, they have basically melted away. That fat has melted away. So what's left? Skin and bone. I'm done.